Well, the figures continue to rise as the number of COVID cases are concerned. Now in Delhi, 2,244 new cases in the national capital. Almost 1 lakh in total. 63 deaths have taken place today, which takes the total tally up to 3,067. 3,083 recoveries, however, also took place. At most, there are, in fact, the total number of active cases is more than 25,000. Rupashi Nanda tracks the Delhi government for us. Rupashi, just when we thought that perhaps things are a little bit improving, here is a huge spike taking place once again in Delhi.
Well, Pallavi, if you look at the number of new cases that have been reported today, in fact, it is less than what had been reported yesterday. And if you look at the figures for the past 10 days, except for the 26th, all the days have reported less than 3,000 new cases. So it is an improvement for Delhi, certainly keeping in mind about the number of cases that we had seen right in the beginning of the last month. Apart from that, remember, in terms of active cases also, it has risen to 27,000 plus over the past 4 days. It has been falling from that, and now it is at 25,032. So this is an improvement over what Delhi had seen over the past few days. In terms of recoveries, also extremely robust recoveries with 3,083. And look at the number of recoveries. It is 71,339. And look at the number of active cases. It is 99,444. So number of recovered patients are definitely, much higher in terms of percentage. Delhi has crossed the national average also in terms of recoveries. So Delhi definitely on the recovery curve, but it is too early to say whether this is going to stay or not, and whether Delhi is actually heading towards its peak. And remember, in terms of number of tests also, it is a robust 23,000 plus. And in terms of RT-PCR tests, also close to 10,000 tests being done. So compared to what we had seen in the first and second week of June, the figures that we see today are an improvement.
Okay, but that's a little bit of ray of hope is that a recovery rate certainly has improved. Many thanks, Rupashi, for putting that into perspective. But if you look at the national figure, India is slowly coming closer and almost could cross the Russia mark. It's taken the total number of infections to 6.7 lakhs. And this is, of course, a sign of worry. 24,850 cases so far. 613 deaths have been recorded in the last 24 hours alone. The recovery rate, however, as I said, is a real hope because it's also going up, and at this point of time it stands at 60.8%. The epicenter continues to remain Maharashtra. It's already crossed the 2 lakh mark. Tamil Nadu also almost recovered, has already registered over 1 lakh the coronavirus cases. Karnataka recorded 42 deaths, 25 of which were from Bengaluru, the highest spike which has taken place in mortalities in a single day in Karnataka. And my colleague Ritangshu actually takes us to all the numbers which are rising across the country.
So the big headline coming today, of course, is from Maharashtra, which has crossed the 2 lakh mark in terms of total cases, thanks to an unprecedented surge of 7,000 cases in the past 24 hours alone. Now, the good news is more than half of the total cases have recovered, with a total recovery of 1,08,000 cases so far. But what's concerned is the fact that there have been almost 300 deaths reported in the past 24 hours, the total now above 8,600. As a result, the mortality rate of Maharashtra is still above the national average right now at 4.3%. Now, this is important to note how the spread of the virus is going on in Maharashtra. If you compare the situation today with what was just 10 days ago, you can notice several districts here now which were marked in lighter shades of yellow and orange have now darkened over the past 10 days, which means that there has been a spurt of infections in these cases, particularly Raigad here, if you can compare this to what the situation is today. This indicates that the the infection is spreading not just from Mumbai, which was a hotspot, but also to the rest of the state here. Let's now look at Maharashtra in some more detail now. If you look at the Mumbai metropolitan region now. Now, Mumbai, as we have been telling you, has about 83,000 cases as we speak. But the suburban areas around Mumbai, Mira Bhayandar, Navi Mumbai, Panvel and Thane also have about 50,000 cases on their own. The total in the entire Mumbai metropolitan region right now is 1,31,000 cases. So it's not just Mumbai, the areas surrounding it also have been locked down because of this spurt in infections here. Let's have a look at how Maharashtra has fared in its battle against the pandemic so far. This was one state which was struggling from day one. Yet, it took 76 days to reach the first 50,000 mark. The next 50,000 came in almost one-third the time of 19 days. The third batch of 50,000 cases, which was from 1 lakh to 1.5 lakh, took 14 days. And the last 50,000 cases have come up in just 8 days, giving an extent of how the progression has been in the state of Maharashtra. Now, this is something which is of deep concern to Mumbai and also Delhi for that matter. Now, we have been so far comparing our cases per million of 488 to the United States and Brazil, which have 8,800 and 7,400 respectively. But in the urban hotspots of Mumbai and Delhi, there's not much of a difference. Mumbai has almost 6,700 cases per million population. Delhi also has almost 6,000 cases per million population. So it's a very grim record and a reminder as to how devastating the pandemic can be, especially in urban centers here. Finally, let's have a look at the mortality rate in Maharashtra, which is what we began this with. It is 4.3%, and compare it to the all India average of 2.9%. Gives you an idea as to how the concern of people dying far more in Maharashtra against the rest of the country is something which is very, very worrying indeed.
And among the many cities which is actually giving us fresh rise for worry is that of Bengaluru, and as a result of which is now under 33-hour lockdown till 5 a.m. tomorrow, and this is to break the transmission chain. As I said, the city has seen a huge spike in the last couple of days. Stacey with this report.
Enough and more reason for the government to worry, and which is why this Sunday lockdown that is being imposed is important for people to follow. And that's the word that the government wants to tell people, that in whatever way they can, they will try and contain the spread of this virus. Now, this Sunday lockdown is going to continue till the 2nd of August, or every Sunday, that is, till the 2nd of August. Now, the idea behind this and how effective it will be is something that people have questioned time and again. But the government here is certain that they're going to follow with this, at least because they want economic activities to continue during the rest of the week. Now, on a Sunday, you're not going to have only essential services function with just grocery stores, milk booths and medical stores that will be open, whereas other commercial establishments will all remain shut. Even food delivery services will happen only through takeaway, and you're not going to have dine-in services function on this Sunday.
Okay, now let's take a look at which are the cities which are actually contributing to this load of corona cases in the country. Look at the list of the top 5 cities really. Topping the list, of course, is the national capital, which has overtaken Mumbai. It stands at 14.4% of the total number of cases in the country. Then it comes up to Mumbai, which is at 12.4%, remains an epicenter. In fact, the state remains an epicenter of the coronavirus cases. Then we go across to Mumbai, as I was focusing off. 42% of the state's load comes from Mumbai, which means 12.4% as far as the national capital is concerned. Maharashtra, of course, continues to remain the epicenter. Next to Mumbai, not too far away, is Pune. 4% to the country's load it adds on. 13% of the state's cases are coming from Pune. Next big is Ahmedabad. Now, 61% of the cases in the state of Gujarat is actually coming in from Ahmedabad. That's a huge contribution of Ahmedabad to Gujarat. Now, Delhi, which has clearly overtaken Mumbai in a number of cases, percentage for the country, it stands at 14.4%, almost reaching the 1 lakh mark. And finally, Chennai. Tamil Nadu, of course, is one huge state of it a spike, 9.9%. In fact, 62% of the cases in Tamil Nadu comes across from Chennai. So that's the kind of a breakup which we are looking at as far as the states are concerned. Now, let's go across to Purnima. Before that, let's take a quick check of the new figures which are coming in from Chennai. There are 4,150 new cases which has been recorded in the entire state of Tamil Nadu, and Chennai 1,713. These are the figures for the last 24 hours. Purnima, there have been strict protocol in place, lockdowns, selective lockdowns. What could be the reason for this huge spike? Is it because there are no cases taking place now, more testing which is taking place now? Is that what the state government is telling you?
Absolutely, Pallavi. That's what the state government, especially the health department, is saying. Overall, in Tamil Nadu, there are more than 33,000 tests that are conducted on a regular basis. and Chennai alone accounts for at least 10,000 tests per day. So they say that aggressive testing is basically to identify people at the earliest to ensure that the mortality rate of the state remains lower compared to other states. And also their strategy is to ensure that aggressive testing followed by recovery rate. These two recovery rate going up. So these are the strategies that the state government is saying, which is why they say that we should not panic looking at the numbers. Chennai continues to top the list and Madurai is the second hotspot in Tamil Nadu. However, aggressive testing will continue because they think that that's the only way to ensure that the mortality rate remains the lowest and also to ensure that they identify people at the earliest and treat them.
All right. Thank you very much, Purnima, for those details. And more tests is what all experts are talking about. And more tests also, the government says, gives a spike in a number of cases as well. Shifting the focus back to Delhi also, which has now overtaken Mumbai in terms of the maximum number of cases. Also concerns being raised that they are inadequate medical facilities. Well, there was one forward movement today when a Union Home Minister Amit Shah and a Defence Minister Rajnath Singh visited the DRDO built Sardar Vallabhbhai Patel COVID-19 hospital in the cantonment area. The centre was created by the DRDO in just 11 days. This facility is going to have 1,000 beds. It will also have 250 specialised intensive care unit. The state-of-the-art air-conditioned hospital is supported by Tata Sons Limited and it has 100 ICU beds, 150 high dependency beds, 750 general beds, along with all the required facilities. Entire hospital is going to be professionally managed by the AFMS medical teams, which are specially trained in COVID care. Staying with the national capital, one of the largest COVID-19 facilities with 10,000 beds is being managed by the ITBP. This opened in Chhatarpur in the national capital. Sagar Gupta, my colleague, gets us this ground report.
New Delhi has set up one of the world's largest COVID care facility. This is called Sardar Patel COVID facility at Radha Swami Satsang in Chhatarpur. Now, as we enter, there are going to be 300 to 400 medical professionals who are going to monitor the conditions of the COVID-19 patients. They are going to take care of them on 24-hour basis. Now, let's take you to the beds facility. There are about 10,000 beds here, and these beds are disposable beds made out of cardboard. These are lightweight but sturdy, can hold up to 300 kgs load. Now, talking about the air conditioning and ventilation here, this is unique in a way because it utilizes 20% of fresh air, and the district magistrate of South Delhi says that it will also reduce the ambient viral load. This is of course going to be operated by ITBP and will treat mild to moderate COVID patients. The first batch of COVID-19 patients will arrive today. We have set up one of the world's largest COVID care facility. It is a big achievement.
यह बहुत ही कृपा की है बाबा जी ने राधा स्वामी सत्संग ब्यास की ओर से है। मेरा ख्याल दुनिया में सबसे बड़ा और हाईली इक्विपमेंट हाई टेक सारा मशीनरी लगी है, हर सुख सहूलियत है, फुली एयर कंडीशन है, लोगों को ज़रूरत है। ये बहुत बहुत बड़ा काम हो गया। दिस इज़ टोटली एक्स्ट्राऑर्डिनरी।
I came here to see this center which has been set up at a very fast pace. All the infrastructure is in place. Delhi administration has joined in, as you know. 10,000 beds are here where COVID care center would also be run. इसका फायदा ये भी होगा कि कोविड केयर जब यहाँ आएगा तो जो हमारे डेडिकेटेड हॉस्पिटल्स हैं कोविड हॉस्पिटल्स उनके अंदर रश की कमी होगी।
Well, many things have changed in the COVID times, and one of the change has been the shifting of studying from real classrooms to the online classrooms. The students attending classes are doing it from home. But there's a huge chunk of population which doesn't even have access to smartphones or even to the internet. It's these people who are facing a huge challenge. Sagar Gupta gets us these details.
For class 12 student Aarti Shah and her sister who studies in class 8, even daily school has to be planned. With online classes the new norm now, only one of them can attend at any given time. Priorities take over, one sacrifices for the other.
हमारे घर में सिर्फ एक ही फ़ोन है जिससे कि हम दोनों बहनों की पढ़ाई छूट जाती है क्योंकि सेम टाइम पे ऑनलाइन क्लास होता है तो हम दोनों सिलेबस कवर नहीं कर पाते क्योंकि दीदी कहीं चली जाती हैं तो उनके पास फ़ोन होता है और हमें पता नहीं होता कि सिलेबस कहाँ है.
The family lives in a slum area in Noida's Nithari. Lockdown meant income from the shop Anil Shah owned dried up. With the financial situation getting tighter by the day, it's come to him terming life Bhagwan Bharose. A new phone is the last thing on his mind. It's the same reality in many households, the flip side of online education due to COVID.
I think before we glorify online learning for children, let's first address the availability and accessibility issues. We recently observed that the smartphone is used by only 20 to 30% of the children studying in a government school for online learning.
It boils down to an India unready to depend entirely on education online. Only 24% Indian households have one member with access to internet. 42% of urban India has internet access, while just 15% of rural India has internet access. Less than 11% Indian homes have a computing device. Big shifts are needed to gear up to new normals.
Implementation of quality of service to provide a better and reliable network connectivity at the remote locations. Centralized technical support at call center should be set up to provide the online support for the students at the remote location who need some technical help. Even free cloud-based storage platforms should be used for future references without any additional cost.
72 minus 19.
Shortcomings in access to hardware and internet for education is a big gap that shows up now, perhaps more than ever before. Because what was once considered luxury is now everyday need. With Sagar Gupta and video journalist Sumit Jagori, this is Swastika Das for CNN News 18.
That certainly is a cause for worry. But let's focus attention on another controversy which has broken up over something which also gave a ray of hope to many of us. And this is over an indigenous vaccine. Now, the Indian Academy of Sciences has opposed the 15th August deadline for this indigenous vaccine. The IASC says that the announced deadline for vaccine development is unfeasible. Science Ministry is also clearly at odds with the ICMR over the vaccine. They have further gone on to say that no vaccine will be ready before 2021 as clinical trials is going to take some time before turning it into a reality. Sneha is with us, who also covers the Health Ministry for us. Sneha, that's the last thing which we wanted. I mean, this kind of two agencies at loggerheads with each other.
Two agencies at loggerheads, and also adding to the confusion was what the Ministry of Science put out a while ago, which they have deleted right now, is the fact that they believe that a vaccine can't be ready before the year 2021. It was a press release, and that has now been rectified, or rather the important portion about the timeline of the vaccine has been deleted and put out by the ministry again. Having said that, the very fact that the Indian Academy of Sciences as reputed an institute is pointing out to the damage of the ICMR. It talks about reputational damage by rushing vaccine development. In the press release that they put out, they say that a letter that has been issued by the ICMR that has been doing the rounds is in fact not something that should have been done at this point in time. While they welcome the very fact that there is a candidate vaccine and hope and wish quickly developed, but the manner in which this was put was wrong. They're talking about the timeline for the phase 1 of the trial, phase 2 of the trial, and how much time it takes. Clinical trials for the candidate vaccine require participation of healthy volunteers. For all these reasons that a vaccine can't be ready at such a short duration, at this sort of a time line, the Indian Academy of Sciences believes that the announced timeline is unreasonable and without a precedent, and is therefore issuing this statement.
But Sneha, wouldn't the ICMR, I mean, after all, ICMR also has several experts. Shouldn't the ICMR actually understood that, this kind of a timeline which they've given is so unrealistic?
It's absolutely unrealistic. And where is this pressure really coming from? Given the fact that even if we were to complete the 3 phases, it takes at least 3 months. The people who are making this vaccine, behind this vaccine, of course, Bharat Biotech, just a day before this letter was issued, Dr. Krishna Ella, in an interview to us, did say that, realistically speaking, he would want this to be ready in a few months and be ready in a couple of months is also an extremely tall order. He did talk about the fact that in some countries like the US and Europe, clinical trials on animals and humans have been combined. However, this sort of a pressure on all the clinical sites is unprecedented. It's 43 days to be precise. When this was actually registered on the 1st of July itself, that's sort of a warning letter in which, pretty much the ICMR is saying that do it. Non-compliance is going to be taken very seriously. That again is something that the scientific community is extremely upset about, Pallavi.
Yes, and the people also who are living in hope, who are looking at this with a lot of hope, they must be hugely disappointed. But many thanks, Neha, for getting us those details. Well, let's do a wrap of news from across the country. First, the Kerala government, in fact, has come up with a one-year roadmap to tackle the virus, which includes strict social distancing norms. For example, only 50 people will be allowed to attend weddings, only 20 can attend a funeral. The government has said that any kind of public gathering like a procession, protest or demonstration cannot take place without a prior written permission, and that too only 10 people can attend it. Of course, wearing of masks has been made mandatory for the next year. To politics, an internal war seems to have broken out within the Maharashtra Aghadi government, and this is over the Home Minister's decision to transfer 10 high-profile IPS officers. Now, this order to transfer the officers, which was issued on 2nd of July, has been revoked. All officers have now gone back to their original position. Sources say that the State Chief Minister Uddhav Thackeray wasn't consulted about this decision by the Home Minister Anil Deshmukh, who belongs to the NCP.
You have general transfers, promotions that the Maharashtra State Police should do. This is the first time ever that you transfer police personnel and then you hold the same transfer. So does that amount to a complete mismanagement? Yes. Does it demoralize the police force? Yes. Does it send a wrong signal for the citizens? Yes. But you have three parties that choose not to answer or respond. And especially when it comes to cases such as this, when you have an official website of the Maharashtra State Police which highlights the transfers of officers, and there you go back, what kind of a precedent are you setting?
To Pune, a COVID warrior from Pune is walking an extra mile to address many needs of the people as far as safety gear goes. This resident has opened an anti-COVID shop to supply urgent requirement of PPE kits or any other such safety gears. Earlier today, Prime Minister Modi met with President Ramnath Kovind, briefed him about national and international issues. The meeting came just 2 days after the Prime Minister visited Leh to take stock of the border situation with China. Prime Minister's meeting with the President lasted for around 40 minutes. We are also being told by our sources that China was a top focus of the meet. Uttar Pradesh Police has announced a 1 lakh rupee reward on gangster Vikas Dubey. A reward of 25,002 has been placed on 18 associates of the gangster. Reward has been announced as the UP police has failed to catch the absconding gangster after more than 48 hours of the killing of 8 cops in Kanpur. A delay in arrest has also given rise to a possible speculation that Dubey might try to surrender before the court. To Mumbai, heavy rains have lashed the city and its neighbouring areas. A yellow alert, which means heavy to very heavy rainfall, has also been issued. Mumbai, Thane and Raigad are the areas which have received this alert. Low-lying areas of Mumbai have already been waterlogged. Sky remains overcast. Strong winds, heavy rainfall is now expected for the rest of the day in the maximum city. To Kashmir, terrorists triggered an IED blast targeting a CRPF convoy in Pulwama this morning. A CRPF Jawan has sustained minor splint injuries. During the search operations, one more IED was found at the same place. Area was cordoned off. IED was defused in a controlled explosion by the bomb disposal squad. And finally, a grim story from Rajkot, where 3 people drowned after a jeep they were travelling in fell off the highway and into a raging river. The force of the water was such that it almost pushed a truck to the edge of the road. But fortunately, the truck driver got pulled out in the nick of the time, but the rest of them, unfortunately, were drowned.